ever been derailed, stopped in your tracks? What's the worst feeling in the world? You're skipping along your day, you're feeling amazing, and then suddenly, sometimes slowly, everything comes to a screeching halt, and you're just not yourself. You're achy, you're tired, you're gaining weight, you're losing weight, your hair, your skin texture is changing, and it all starts to make you really anxious. Does any of this sound even remotely familiar? Well, I meet women every day who tell me that they just don't feel like themselves, that they've lost their oomph, they've lost their mojo, and they don't know why. Now, everyone's story is different. For a lot of us, it's our hormones that get us in trouble. And as women, hormones regulate so many essential parts of our being. They're vital to our vitality and can switch us from being super women to being super checked out really fast. You probably know the obvious signs of hormone imbalances, but let's review them just in case these slipped by you. The first and most obvious, and the one that usually alarms you very quickly, is a missed period. You might let the first one go, but then when you constantly have missed periods, hopefully you know that something's wrong. For a lot of you, you'll dismiss it, or you may make that appointment with your doctor. The second is irregular periods, and this is something that I see in practice that so many of you ignore. You think it's okay to have a period 1 month, and then wait a couple months and have another one, and maybe a year goes by and you have another one again. Well, irregular periods, remember, are a sign of hormone imbalances. Hair loss, and I think we miss out on how important our hair health is and how it can be one of our vital signs. It can be a life force almost in helping us identify what's wrong with us. So the quality of our hair, if your hair changes, if it loses a certain texture, if it gets thinner, or if it gets oilier, these are all signs that you might have a hormone imbalance. Now the next one, I know you all know, because I hear this every day in the patient room, and everywhere I go, someone asks me this question. How do I lose weight? What can I do to lose weight? What's happening? Why do I suddenly have a belly? I never had that before. Well, weight gain, remember, is due to a lot of different reasons, but as women, one of the first places we have to look is what's happening with our hormones. So your weight matters, and it's another clue for you in terms of where your hormones are and what could be happening. Acne. Now, I've struggled with acne too, and you might be struggling as well, but it's not something you have to accept. Acne, no matter how many topical foams and lotions and treatments you do, is ultimately rooted in your hormones. And it's a sign of an imbalance in a particular hormone called androgens. And these hormones produce a lot of oil, they change your pH, and they force your skin to break out. And last but not least, one that you may know, anxiety and depression, or just a change in your mood. There's so many great stories with this one, unfortunately, but so many women come to me and tell me that they are normally happy, the world is a happy place, there's light everywhere, and all of a sudden something changes. They just are dark, they're negative, or worse, they're taking it out on their families. I've had women come to me and tell me that the week before their cycle, no one wants to be around them. Their spouse tells them they just turn into a different person. They turn into a shadow version of themselves. Do any of these sound familiar? Well, you might be sitting back and saying, I'm great. I don't have any of these symptoms. I'm perfect. My hormones must be great. My periods are regular. My hair is great. I'm always happy and chipper. So there is no way, Dr. Taz, that I could have a hormone imbalance. Well, here's the thing. There are other symptoms and signs of hormone imbalances that are a lot less obvious. These are the ones that get us by surprise. These are the ones that we just dismiss or we shrug off and we say, maybe I'm just, wait for it, maybe I'm just too old. And that's the line nobody's allowed to say around me. I get so annoyed by that line because it's not about being old, it's about really optimizing yourself and trying to get balanced. So here are a few of those more subtle, maybe they are slipping by you signs and symptoms that I want you to be aware of so that you also can know where your hormones are at any given moment. So changes in skin color. Now this is one that can easily slip by you. You may think that you have a tan, or you may think that you're just a little pale right now, but any fluctuation in your baseline skin color is often a sign of hormone imbalances. So pay attention to it. Maybe be a little bit more conscious when you look in the mirror and pay attention to your skin. Changes in your eyebrows or eyelashes. Now this is one that as women hopefully we're noticing, but many women who are busy don't. But if you're losing your eyebrows or you're losing your eyelashes, again, that's a sign of a hormone imbalance. The most obvious one is thyroid, but it's not always about your thyroid. So that's where it gets a little bit tricky, and it's important to understand that all the hormones play together. Taking a look at your nails. nails. I always know when my hormones are off because my nails will start to break a lot more easily. Instead of growing and me trimming them, all of a sudden they're cracking and they're peeling with just a little bit of housework or working out in the yard. So that's another sign that so many people ignore when it comes to their health, and especially their hormone health. The texture of your hair. Now again, a lot of people just think about hair loss, but if the texture of your hair is changing, it goes from dry to oily or oily to dry, or it's now more frizzy than what you're used to, that's again another sign of a hormone imbalance. Your sleep cycle, and this is one that women talk to me about all the time. They can't fall asleep, they can't stay asleep, and they don't really know why. And usually they'll try a host of different remedies, right? You'll try maybe a medication that your doctor prescribed, you'll try all kinds of different supplements, but you're still not able to sleep. And just not being able to sleep leads to so many other conditions. Everything from getting more anxious to just being tired throughout the day to not being able to think and focus through the day. So sleep is critical, and it's critical for hormone imbalances. So much so that in Chinese medicine, they talked about the importance of sleeping from at least 11 p.m. to 5 a.m. or the entire hormone pattern would be disrupted. And again, that's one that I experienced just working in the ER for so many years, where I did day shifts and then night shifts and then day shifts, and my entire hormone pattern fell apart. So sleep is critical, and if you can't sleep and if you can't stay asleep, that's a sign often that you're low in progesterone. And progesterone is a hormone so important for women's health, and it's one that really helps calm our nervous system down, helps us settle down, but when it's gone or when we lose it, then we have a lot more sleep issues. So pay attention to your sleep patterns. Has that changed? Has anything shifted there? Joint pain is another one. Joint pain is all about inflammation, and hormones are connected to inflammation. My patients always get super surprised when I tell them that. They always think that the joints are completely separate from the hormones and everything lives in kind of isolated boxes. But joint pain is a sign of hormone imbalances, and when your hormones are off, it can trigger the cycle of inflammation. That's why in practice I see so many people with different rheumatological conditions, right around times of hormone transitions. So they'll get an autoimmune disease and they'll get it maybe right after being pregnant or right before going into menopause or in that kind of vague perimenopausal area. So again, joint pain is something that's really important to pay attention to. And I think last but not least is just our cognitive function, our brain function, how we think. I have so many stories of powerful women who told me that they could own a room, they could walk into a meeting, they could speak to 500 people and do it well and not get nervous and go from point A to point B to point C and really know that they nailed it and walk back out of there and feel great. And all of a sudden, they can't remember the next word that they were supposed to say. And they can't remember how to get through a simple meeting, leave alone an auditorium full of people. And something in them has shifted and changed, and they get scared and they're worried that they have a big disease in the brain or they have Alzheimer's or something else is happening, or the classic line that they're just getting too old. Well, for those women, sometimes the very first place to start is understanding what's happening with their hormones, because all the hormones, estrogen, progesterone, thyroid, insulin, cortisol, all of them affect the way we think. So again, hormones and women, powerful stuff. It changes the entire way we function, the way we see ourselves, and bottom line is it regulates so many different facets of our being that when we're not tracking them and we're not conscious of them, they can go astray, and it creates complete havoc in our bodies. It undermines our confidence, our self-esteem, and ultimately our ability to think. And guess what all that adds up to? That's our power. And once we lose our power, we become shadow versions of ourselves. Now, I know none of you want that. We all want to feel on top of the world. We all want our mojo. So I want you to know your hormones and know the signs and symptoms of when your hormones are out of balance and get these levels checked. I'm shocked. I continue to be shocked that women don't know what their hormone levels are, and they don't even ask to get them checked. So get them checked at least every 6 months. You have to know you're normal, because then when things kind of slip a little bit, you know what's changed. And that's something that I live by as well. For more information on hormones and the hormones that you need to know, check out the video below.